My name is Clycatron, and I'm doing a case study presentation for my Psychology CCA class with Dr. Quincy Singleton. My case study presentation is going to be based on a 32-year-old female named Michelle. Michelle, who has expressed concerns, serious concerns with her line of work. She feels like she's been unable to focus, she feels completely disorganized, she is restless and agitated, she forgets where she places things, important things. No matter how hard she tries, she still forgets. No matter how hard she tries, she fails to maintain focus. No matter how hard she tries, she cannot organize anything. She tearfully breaks down by saying that her boss has threatened her with termination because she has consistently failed to meet deadlines on time, no matter how hard she tries. To add on top of that, her husband has expressed a desire to starting a family with her, but she feels completely inadequate to do so because nothing ever seems to fall in place in terms of maintaining control. In result of that, she's also said that she's started using methamphetamines for the last year. She feels that using methamphetamines has helped her at work with her energy, with her focus, but that dependency on methamphetamine has gone completely out of control, where she would binge on some days and then she would experience crashes, and she doesn't know what to do because her health has been dwindling and nothing ever seems normal anymore because she has added methamphetamines into her lifestyle. She doesn't know what she's struggling with. Well, first of all, in terms of her diagnosis for a disorder, I think it's clear to see that she might be struggling with ADD or ADHD because she forgets where she places things, because she can't maintain focus, because she fails to meet deadlines on time. These are the criteria that actually meets for attention deficit disorder diagnosis. But also because she is restless and agitated, or she feels hyperactive, she meets the criteria for attention deficit hyperactive disorder. The interesting thing with ADD or ADHD is that there is a medication known as a stimulant, and these stimulants stimulate the person's central nervous system, and these medications are usually known as Adderall, Ritalin, Concerta, or Desoxyn. Desoxyn is actually pure methamphetamines. Now, the reason why people with ADHD or ADHD find so much resolve with stimulants is because they are oftentimes experiencing dopamine deficiency. When a person is deficient on dopamine, the brain is reaching out on neurotransmitters with dopamine, or they're experiencing with some kind of blockers from obtaining dopamine where they need to focus on some things, or getting some things done, or meeting deadlines on time. When a person experiences dopamine deficiency, they may appear restless or inattentive or unable to focus, or their mind is going all over the place. And when they are prescribed ADD or ADHD medication like Adderall, Ritalin, Concerta, or Desoxyn, it's oftentimes they actually find some sense of calm and focus on these things because their brain has been supplemented with dopamine. Now, I'm not sure if Michelle is using crystal methamphetamines or she's using prescription methamphetamines. It really depends. If she's using crystal methamphetamines, she's obtaining way too much more dopamine than she should if she's experiencing dopamine deficiency. And with crystal meth, you don't even know what's really in it at the same time. It's easy to have your life completely out of control. It also comes with a lot of issues like mental health disorders, or a case of psychosis or schizophrenia or hallucinations and all that stuff. It's really impossible to find some sense of normalcy with crystal methamphetamines at all. And also, she says that she's experienced crashes there are instances where if you're using methamphetamines for several days, you will naturally crash out of exhaustion. But there's also a case or a chance of coming across fentanyl, crystal methamphetamine. So I'm not sure if she's like using or she's having fentanyl in her system, because oftentimes in the streets, drug dealers would put fentanyl in methamphetamines to make them more addictive and to attract repeat customers, and they would be using crystal meth laced with fentanyl as if they're using crack cocaine. Um, they're not as long lasting because of the opioids, the synthetic opioids in it that brings you down, and then you're gonna need it to bring you back up, down. It's a horrible roller coaster. But if she's using prescribed methamphetamines, which would be digoxin, it's really hard to know if she's actually taking it as prescribed because she's not seeing a doctor for it. She's using it on her own behalf. So if I was her psychiatrist or psychologist, I would assume that she might have ADD or ADHD. But the first, most important thing is to, for me, is to send her to a 90-day detox so that her brain can actually normalize itself from the dopamine, the serotonin, and norepinephrine that methamphetamines will actually cause a cascade into her mind, and she would feel like she's doing everything the right way, the one and only way, because it attributes so much to her reward system. She feels like nothing is going wrong. But the thing is, she's completely out of focus. She's probably too energized. She crashes. Nothing is on schedule for her. That's the case with crystal methamphetamines or methamphetamines. So I would send her to a 90-day detox so that her mind comes back to normal. And then I would see if maybe she is experiencing dopamine deficiency. She could be prescribed on some stimulants like Adderall or Ritalin, Concerta, which is at safe lower doses for individuals like her struggling to focus. It would help her. She will also need cognitive behavioral therapy, where she has to understand what is addictive personality disorder, or understand the concept of addiction or being dependent on addiction. And she has to understand her reward system, where she needs to be careful of being dependent on substances to feel like she's succeeding something in life. It is more important to see a doctor to maintain some sense of normalcy, and then to accomplish reward in a normal sense, where she's not using drugs that's completely taken over her system. Prescription medication is only supposed to supplement her, not overtake her mind. But that's only with some psychiatrists. Some psychiatrists are vehemently against stimulants, and that's the ethical decision that psychiatrists or psychologists has to make, deciding if they want to supplement her with what's it called, stimulant replacement therapy, where they're replacing her methamphetamine addiction with a methamphetamine prescription, or methamphetamine prescription. That's stimulant replacement therapy. That's really up to the psychiatrist or psychologist to decide if that's the right thing for her, because some psychiatrists are against it, and they will actually prefer for her to be on medications like Wellbutrin or on Strattera. Wellbutrin and Strattera are very similar. They are a norepinephrine dopamine reuptake inhibitor. They help attribute her with her dopamine levels and norepinephrine levels, but not in a sense where it stimulates her central nervous system like stimulants or methamphetamines do. Some psychiatrists prefer that. Some psychiatrists would prefer nothing at all, which is, I don't think that's often the case. From my personal experience at drug treatment centers, I was not allowed any stimulants whatsoever, but I was allowed Wellbutrin, and I feel that helps me to a sense where I have to use caffeine to have the the best of the caffeine and Wellbutrin. But anyways, for her, it really depends on the psychiatrist and their ethical decision to diagnose her or to prescribe her with proper medication. She needs cognitive behavioral therapy. She needs to understand that, you know, methamphetamines is not really the way to go. And the fact that she's come out to reach out about this situation is the best thing she's ever done for herself. And that I know it's better than using methamphetamines. And I wish her the best of luck, because this is the best I could do for a case study presentation. I hope it's alright. Thank you.